this is a time that we're going to take to talk about some courses that my dear friend Micheal McEvoy has produced. Micheal is an educator and as well as a clinician, but he's someone I learn a lot from, and he has spent a lot of time and energy to put together courses that can teach clinicians the stuff that we thought we learned, but we never really did, because basically the information wasn't put together for us. And Micheal has done a lot to bring what's the cutting edge information, because, he has 4 courses. One of them is on iron, on cardiovascular disease, women's health, and on blood sugar. Now, I can tell you that all of them are fascinating, but the iron studies, because iron is an issue that I can assuredly tell you that almost no doctors understand. Okay, because almost every doctor still thinks ferritin is a molecule that carries iron in your body. So, and there's a lot more to understand about iron metabolism and what really ferritin represents. So, Micheal, you want to give us a little overview of these courses, and I'll chime in here and there.
So I've been making courses for 12 years, and I'm now really at the point where, I should say we're at the point now where we can start to really mine the literature in different ways to really understand a lot of health problems, to understand a lot of subjects that have just not been fully understood. And iron being one of these, of course. One of the courses is about iron in all of its different shapes and forms and in its complexities in disease. One of the most misunderstood elements of our biology, one of the as I call it, double-edged swords, one of the most important, yet also one of the most destructive. And there just needs to be a course about it, about everything about it, about the biochemistry, about the clinical applications, about anemia, about iron overload, about copper and ceruloplasmin and all of the proteins involved, the evolutionary biology of it. This is what this course is about. So I've put it together. It's going to be one of 4 new courses that we're going to be releasing in 2025. The second course is on cardiovascular diseases, cardiovascular health. And in this particular module, I'm assembling a whole variety of different literature to basically look at the biochemistry of what goes wrong, the initiation of cardiovascular disease, the new science that basically illustrates that oxalams and inflammatory fatty acids are the initiating cascading free radical event that causes the oxidation of LDL to form and the foam cells that form. So this course is going to deconstruct a lot of what you thought you knew about cardiovascular disease, and it's going to be looking at some of the biophysics of the cardiovascular system, including the glycocalyx and the role of negative charge dynamics in different cells to prevent a clumping and agglutination of cells and of platelets, for example. We'll talk about introducing Dr. Ravisi's monumental body of work, who was a very important scientist and chemist of the previous century, and how his ideas have really shaped my understanding of the underlying pathophysiological context of coronary artery disease, and how we can learn from some of the more complex chemistry of sulfhydryl antioxidants with respect to what we can do therapeutically. The third course is going to be on diabetes and blood sugar. I've identified that there's about 8 physiological factors that really have to be addressed in somebody with type 2 diabetes mellitus. Everything from energy metabolism to mitochondria to environmental toxins to genetics to endocrine dysfunction. All of these things are going to be covered in this module. We're going to be putting it all together, and we're going to be distilling it down for clinicians to be able to take it away Monday morning with clinical applications ready to go for the patients that are sitting at their door. That's what these courses are designed for. The fourth module is on female health issues. We're going to be talking a lot about testosterone, hyperandrogenemia, and what the consequences of this are, as well as very simple therapeutic tools that have proven clinically to work. And so this is going to be a tremendous 4-course series that we're going to be releasing here in 2025.
Yeah. And what I just want to emphasize for people is the ability to gather. Because it's not just you're going to learn a tool so you can give somebody, a supplement or a medicine. No, it's the ability to understand the physiology so you can really think about it. because what happens when we go to courses that we learn here, ABC, and then, take this peptide and take that, is that, but we can't really think, and what to do. And that is the beauty of these courses, is they teach you the science at a level that you can think with it. And, that was the idea of medical school, but it got lost somewhere along the line because they just taught you how to memorize stuff and then not think and just give drugs. So where Micheal is now building on that basic, you know what the words mean, but now you're going to learn how to think with those words and really understand physiology enough so you can apply it to your patients.